the Greater Pittsburgh Orthopaedic Association, Pittsburgh, Pennsylvania. Thanks for having me here this morning, and I'm going to be talking about on-table femoral exposure. I have no disclosures, unfortunately. So if I'm talking about on-table femoral exposure, I have to discuss the table, and I'm going to be talking about the HANA table. First, because it's how I was trained, and it's what I use essentially 100% of my hip practice. However, I'd also argue that it's the gold standard for this application, and while there are alternative tables out there, the Rotex, Amis, I think that by and large those have been developed largely trying to replicate the function of the HANA table at a lower price point, so accept no substitute. So what are the features of the HANA table? And some of these have already been touched upon in earlier talks. It goes up, it goes down at airplanes, it's Dellenbergs, it's radiolucent, so you can use X-ray effectively, but really defines it as far as the femur is concerned are the powered femur lifts controlled with a foot pedal operated by the surgeon, and the leg spars, which permit manipulation of the leg throughout the procedure. And when used properly, the HANA table is a powerful tool that can really help you get good femoral exposure, protect the soft tissues, and get reproducible results. Starting with the femur lift, there's one for each side of the table, with a selector at the head of the bed to determine which is active. They're controlled with a foot pedal. Here the lift's depicted with the hook support, which some people call the ladder because it's in place. And the lift is, a part of the table. It's therefore not sterile. The hook support is sterilely processed for each case, and it rests on top of the lift. Just to comment on draping, I typically cut a hole in the drape with a 10 blade, place the hook on top of the lift,